everyone. Myself, Dr. Priyanka, and I'm one of the mentors for Study MRCPI. So we are doing OMR series, that is OSCE Made Ready for MRCPI OSCE examination, which will discuss very important exam stations for your MRCPI OSCE exam. So do like, share, and subscribe the Study Medic channel, and also press the bell button icon to get the recent updates on the added videos. So today we'll be discussing an important station, that is the sexual assault structured discussion. So we will go further. So do remember that your talent determines what you can do, your motivation determines how much you are willing to do, and your attitude determines how well you do it. So here this is a structured discussion where you are registrar on duty and you are called to see a 24 years old girl who is Maria. She has presented in accident and emergency department at 3 a.m. after she was sexually assaulted. So there you have 10 minutes where you will discuss with the examiner. The examiner will be having few questions and you have to uh, answer the questions. So, what are the important points in her history that you want that we want to know? So, here the important points in any case of a sexual assault. So, here first we would like to introduce ourselves to the patient, then tell our roles. So, what are we going to do? We are going to take her history and also do the basic examination. Also, after confirming the identity. So, as this is a case of sexual assault, so here the patient is already psychologically very distressed, and so that's why we have to talk very sensitively with the patient, and our tone should be very soft, and we should be empathetic. So, what are the information that we want to gather from this patient sensitively, very sensitively, and we have to assure her the confidentiality that if because they are very scared, so we assure the confidentiality, and we ask the questions like what happened, and also when it happened, what was the time the sexual assault happened, and also where it happened, what place it happened, okay, and who did it. So was it a single perpetrator or multiple or many people, okay, and also we have to manage it like an emergency because as the time goes there is loss of evidence and hence it is also managed like an emergency, and also we have to take a proper detailed history and examination. We have to do the examination of the patient. Also we have to ask her that was a condom used during the time of sexual assault, and also did the ejaculation occur. So then we can come to know the risk of pregnancy she can have, and also the risk of sexually transmitted infections. And what kind of assault it was? Was it an oral or a vaginal or an anal? Okay, so that also needs to be known. And we have to also consider regarding pregnancy prevention and also prevention and screening of sexually transmitted infections and forensic evidence, that is the SATU in Ireland. And also, most important is we have to ascertain her anxieties and address them. And also, we can refer her to the psychological counselor where she will be able to share her views. So how will you manage her further? Is here we have to see if there are any injuries present along with the case of sexual assault. Sometimes they may get bitten and there can be injuries. Okay, so which should be managed by a first aid, and also some samples can be taken from these sites for DNA evidence of the perpetrator. Then also this injury should be described very properly for the medical legal purpose also. In the injuries, we have to describe the location of the injury on the body, the size, how it is, and also the shape of the injury, the color, the depth, and the tenderness. So here how we describe injuries is we use anatomical landmarks. So for example, if we can describe that there is injury around 1 centimeters, circular in shape, which is around 2 to 3 centimeters below the knee joint. We can use a fixed point of the anatomical landmarks to describe the injuries. And most important is we can draw and also document the injuries by digital photo documentation. So after the post-assault history is taken, we also have to ask the patient that is she has she showered or has she douched, and also has she brushed her teeth or vomited, because that may lead to sometimes loss of evidence. So asking this history is very important, and also any history of use of sanitary pad, tampon, any diaphragm use after sexual assault is very important for the evidence purpose. And also, we want to know that was she intoxicated at the time of sexual assault? So that's why any consumption of drugs, any history of alcohol at the time of sexual assault needs to be known. Most important thing is knowing about the last menstrual period, and also because we want to know and also her cycles are regular or not. So if her cycles are regular, we want to know what period what is the day of the cycle, and so that we can calculate the risk of her in having pregnant. So here that's why and also what contraception she is taking is also very important. What kind of contraception and how compliant she is, because if she is not compliant with the contraception, then there is failure of the contraception and there is a this chance of pregnancy, unwanted pregnancy. And also post assault, any symptoms she has, any case of vaginal bleeding, any pain, any urinary symptoms, burning, any itching, that also needs to be addressed. So what are the contraceptive options you can offer her? So here usually if they do not have any contraindications, they can be offered all sorts of emergency contraception, that is the copper IUCD, the ulipristal acetate, and also the levonorgestrel pills. Okay. So the most effective one is with the least failure rate is of course the copper intrauterine device, uh, which has the least failure rate, and also the other another benefit is it is a long acting method of contraception. So that is the most effective one. And another benefit is it can be inserted like up to 5 days after the ovulation so has occurred. Okay, so about the oral pills, oral emergency contraceptives like the ulipristal acetate and the levonorgestrel, so if once the ovulation has occurred, so they won't be effective, and only the option remains is copper IUCD. Also, ulipristal acetate is not given in patients with a history of asthma. So all the important points in the history needs to be known to give the patient appropriate the best method of contraception. So, how we will screen her for sexually transmitted infections? This is also one of the most important part of management of a sexually assault victim. So here it should usually be done after 2 to 3 weeks after the incidence of sexual assault, and we can give post-exposure prophylaxis, which is usually started within 72 hours of the assault, and it is usually continued up to 4 weeks, especially in case of high risk individuals. So who are high risk individuals? So those who are having multiple sexual partners, or those who had anal intercourse, for example. So they are those who had history of previous STI. So they are the ones who are at high risk. So in them, it is continued up to almost 4 weeks. And serology is usually done after 3 months of the assault for HIV, hepatitis B, syphilis. Okay, and also the highest risk is with unprotected anal intercourse. So, regarding hepatitis B vaccine, that can also be offered to unimmunized adults, and it can be given at the same time, that is the same time, and then 1 and 3 weeks later, or it can be given at the same time or 1 or 2 months with a booster of 12 after 12 months in either course. So, what is early evidence kit in Ireland, and what does it comprises of? So, here it is usually used in cases where there is a history of a non-consensual oral sex, okay, or the is suspected to have an element of sexual offending, or or there is suspicion of intoxication by either drug or alcohol. So what does this early evidence kit contains? It contains the instructions on how to use the kit, also disposable gloves, 5 swabs, small universal container, and large container to collect the urine sample, and sterile water, and also tamper evident bag to prevent the loss of evidence. So this early evidence kit is present in all the Garda stations, that is the police stations in Ireland, and it can be accessed quickly. So do remember that this early evidence kit, which collects the evidence, the main purpose is to prevent till the proper forensic team arrives, that is the SAKI team arrives, to prevent the loss of evidence. The main purpose is to collect the evidence of this early evidence kit. So this early evidence kit is not a replacement for the existing sexual offences examination kit by the forensic examination. So first what we have to do is, there is always an expiry date for the early evidence kits, and we have to check that it is still in the validity period. And also we have to take the swabs as soon as possible and preferably within 24 hours. And the three swabs are taken. The swab sites include the mouth and the gums and teeth, also the lips. And whenever the early evidence kit is used, we have to inform the forensic examiner that it has been taken. So what is the role of sexual assault treatment unit, that is SATU, in Ireland? So here they have four main function components. That is, they take care of the sexual assault victim in the medical care, okay, and also any treatment of the injuries, and also the most important component is prevention of and treatment of sexually transmitted infections, giving emergency contraception to prevent unwanted pregnancies, and the most important, they also have the function of providing psychological support. So how you will do the forensic examination? So here the SATU, that is the forensic examination team in Ireland, they do the collection of DNA and other evidence without informing the Garda, and the woman is given the opportunity that she can inform the police or she may not. And if she doesn't want to inform the police, then she also has an option that whenever later she wants to, her mind changes and later she wants to inform the police, she can inform at a later date. Also, it is used by the clinician with specialist training. So the forensic examination should be done preferably by a forensic medicine expert to collect the forensic evidence. So when can this forensic evidence be collected? It is very important. So the swabs, the oral swab, it is collected maximum 2 days, that is 48 hours after the sexual assault time. The anal swabs are taken after 3 days, and the vaginal swabs are taken can be taken up to maximum 7 days of the assault. And when can we check for the toxicology, that about toxicology screening? So from blood we can check up to within 72 hours, and from urine from maximum up to 14 days we can do the toxicology screening. So guys, this was all about the sexual assault. So thank you for joining. Thank you so much.